Assalamualaikum doctor. In this video I am discussing how can we take the history hypoglycemia. So the chief complaints or task can become like that: 2 years with fainting attack. Then so this is the fainting attack, our chief complaints. First we will present illness analyzing, like what happened before, during, what the child do, after, how it avoided, or what she did. These are we asking. Then was is the first time or to occur or recurrent? If recurrent, when was the first time? Okay, what did you do when it occurred? Is it preceded by any fever or illness, fasting overnight, or infrequent feeding? So very important. Anyone fainting attack, we know that hypoglycemia can be the cause. So last when eating the meal, this is very important asking. And is that fever, any intercurrent illness? These are. So nutritional history brought earlier, like tell me more about his feeding. Is he breastfeed or formula feed? What type of formula? How are you feeding him? Who prepares the bottle? How many times? How much is he taking every time? Did you start weaning? Are you giving supplementations? So this is very important. Now general questions are like weight loss, change in appetite, daily activities and sleep affected or not, like any chronic condition, unusual any facial features, large trunk, midline defect. So unusual any facial features, because we know Beckwith-Whiteman syndrome is associated with hypoglycemia. That's why we are asking. It is one of our DD here. Then the systemic review you go. GIT increase the tummy size, like hepatomegaly, tummy pain, loose poo, throwing up, oral soreness, lips cracked, anal soreness, and yellow eyes. Then endocrine about the thyroid, hot intolerance, diabetes mellitus disease, measure the blood glucose before, CNS about the feeds, loss of consciousness, unusual movement, sudden change in mood, like unusual crying, morning vomiting, deviation of the face, eyes, red eye and eye color, eye cloudiness, ears are large and creased, concern about the vision, hearing or speech. So here any red eye cloudiness, because mucopolysaccharidosis, glycogen storage disease we are keeping there. Then ears large, tongue increases, whatever the ear, because Beckwith-Whiteman syndrome is another DD. These are the we are keeping. CVS about the racing of the heartbeats, fainting episodes and sweating during the feed. Then hematology about the pallor, bleeding, bruising, any recurrent bugs. Urinary about the pee color, amount, painful peeing, recurrent bugs, through the urine, urine dipstick. Genitalia about the private parts, appearance, blood pressure measured. Chest about the rapid breathing, coughs and colds, runny nose, nasal discharge, chest pain, noisy breathing and recurrent chest bugs. MSK about the skin spots or pigmentation, swollen neck glands, lumps, bone pain, painful joints, bluish discoloration of the gums or nails, changes in the hair and nails. Then past history 5T IOA, previous hospital admission, team, any trauma. Parental history about the jelly scan in pregnancy, liver, birth weight, newborn heel spot test, any abnormality in newborn examination, any neonatal hypoglycemia. Very important asking that. Prolonged jaundice, NIQ admissions. Developmental gross motor, fine motor, social speech plus growth chart. Vaccinations up to date, extra shots, allergies like to certain foods or drugs, family history of any consanguinity, family history of similar condition or any inherited disease, previous sudden death, infant death, are you living together, do you have other siblings, possible child access to the medicines or alcohol, oral any hypoglycemia agents, alcohol, aspirin, beta blockers and insulin, social, financial and home and psychological impact. So this is the child come with hypoglycemia. So DD we are keeping. First of all, it can be non-ketotic. Most common cause of hypoglycemia is ketotic hypoglycemia during the period of fasting and illness. But endocrine and metabolic causes should be excluded first. So ketotic hypoglycemia. And we can keep ketotic hypoglycemia. What happened this time? Decrease the glucose, undetectable insulin, increase non-esterified fatty acid, increase beta hydroxybutyrate. Remember, during a period of fasting or any intercurrent illness, child has gastroenteritis suffering, or fever, long time vomiting, malnutrition, malabsorption, sepsis. So ketotic hypoglycemia is one of the DD. Then growth hormone deficiency we can tell, cortisol deficiency, glycogen storage disease and ketotic hypoglycemia too. So these are the DD. Metabolic we can keep, glycogen storage disease, commonly type 1, glucose 6-phosphate deficiency, galactosemia, hereditary fructose intolerance, fatty acid oxidation defect and defect in amino acid and organic acid metabolism. Okay, so I am telling you what are the cause of hyperinsulinism. Decrease glucose, increase insulin, decrease the non-esterified fatty acid and decrease beta hydroxybutyrate. Congenital can be occur, like genetic defect in the genes that regulate insulin secretion. That is one of our DD. Transient, infant of diabetic mother, maternal beta blocker, Hypothermia, IUGR, and birth asphyxia. So IUGR is one of the cause of hypoglycemia, which comes communications. It is a transient, remember, it will improve with time. Then exogenous are accidental injections, non-accidental are Munchausen's by proxy. The neoplastic are insulin-producing tumors, adrenal insufficiency, primary Addison disease, congenital adrenal hyperplasia, secondary ACTH deficiency or part of panhypopituitarism, trauma, tumor, infection, growth hormone deficiency, and hypothyroidism. Syndrome we keep in our mind: Beckwith-Wiedemann syndrome, hyperinsulinism, suboptic dysplasia, and panhypopituitarism. There are lots of causes. These are the main cause in DD. When we take a 2 years age old child, hypoglycemia, hepatic or hepatitis cirrhosis, and Ray's syndrome. Drugs and toxins are aspirin, alcohol, insulin, oral hypoglycemics, valproate, and beta blockers. This is all about hypoglycemia history. Thank you.